Hello, I'm Dr. George Bottomley, the founding director of the Physician Assistant Program, which is housed in the Center for Physician Assistant Studies, which is behind me. Let me give you a tour of the inside of the building. The first thing you'll notice is on the left we have the mission of the PA program. The mission of the Physician Assistant Studies program at Johnson & Wales is to educate students to become collaborative practitioners with the respect, empathy, and trust inherent patient-centered humanistic healthcare. You enter our foyer. We have a large suite of faculty offices over here to the left, reception area. As I mentioned earlier, the building's won some awards. We also have pictures of our first two graduating classes. Very proud. We have two large classrooms on the first floor. Let's go into the lecture-based classroom first. This room seats about 60 people and is a traditionally constructed tier-based classroom that allows students to see the front board clearly. But a few things are very interesting about this building. We capture all the lectures digitally and post them on our learning platform, Blackboard, within 24 hours of the lecture. We've also set up the classroom so that students can work spontaneously in small groups. Each level has 2 rows of seats on it, so that if we give students a project to work on in here, they can immediately start to collaborate, part of our mission, and work together to do some problem solving. Our second classroom is really a team-based classroom. It's set up so that groups of students can work together, as these students are, and work in small groups to do problem solving. Digital capture capacity that the first classroom has. But you can see that if we give students a project to work on, they can come in and hook up their laptops, project things onto screens, and work collaboratively through various problems that they may have. We can reconfigure this room as well into a more traditional classroom, because all the chairs and all the tables are mobile. There are very few PA programs that are devoted strictly to the study of physician assistant studies. Our students are the only students on campus that have 24/7 access, SWAPE ID access to the building. So we have students studying at high-top tables. We have a number of small group conference rooms where students like to work. They really make good use of the whiteboards as they study. We have a quieter space over here with our library and another small conference room in back where students like to huddle and work. Yeah, while the vast majority of our books are available electronically to students through our e-library, we have hard copies available for them to use as well. We put the history of the PA profession on the wall. It started from a critical shortage of primary care providers after World War II, and has emerged and become one of the most popular healthcare professions today. Since students spend so much time in the building, we put in a kitchenette with microwaves, a couple of refrigerators, their own locker rooms, and a shower room. They like to use a shower room. They spend a fair amount of time in the anatomy lab, especially during the summer, so it gives them an opportunity to change and shower between lecture and lab. This is our clinical skills lab, where students spend a great deal of time in their didactic year learning how to perform a history and physical examination. They work in groups of 2, use each other as patients, and one plays a PA, and they enter their findings in an electronic medical risk records system that we have loaded up on our computer in each cubicle. We also use this room as a wet lab. This is where, between the didactic and clinical years, students learn their suturing techniques, their venipuncture techniques, how to splint, how to put a splint on a patient and cast a patient. This is our anatomy lab. And we use real cadavers. I think in a period when many medical schools and PA programs are using simulated cadavers and electronic cadavers, we believe in the importance of a student doing their own dissection and learning the interrelational, 3-dimensional aspects of the human body. And this really is the best way to do it. There are 4 students to each cadaver, very good ratio, and students have the ability to either use their dissection guide, which is loaded onto their monitor, their computer, that can be moved over the body, or they can do it the old-fashioned way with an anatomy textbook. If there are any interesting findings on any of the cadavers, we can roll the table over here, put the interesting finding under the high-definition camera, turn the light on, and project it onto all of the screens as well, and capture it for further reference.